Coming up on Mayo Clinic Q&A. For those who are suffering from severe arthritis pain in the knee joints, knee replacement is a viable option to improve a person's quality of life. Today on Mayo Clinic Q&A, we'll look at augmented reality and how this new technology is helping patients achieve long-term success from knee replacement surgery.
Benefits of this augmented reality system is that we can make more precise and accurate bony cuts and make the angles more correct to make the limb more straight. What we want to do is reduce the outliers. We can more efficiently and more precisely do their knee replacement.
Welcome everyone to Mayo Clinic Q&A. I'm your host, Dr. Helena Gazelka. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It most commonly affects joints in your hands, knees, hips, and spine, and the symptoms can often be managed with non-operative treatments, but damage to joints cannot be reversed, and sometimes joint replacement is necessary. Orthopedic surgeons now have a fascinating new tool in the OR, augmented reality knee replacement. And I can't wait to learn about this with you today. So we have orthopedic surgeon, Dr. Michael Taunton from Mayo Clinic here to talk with us. Welcome, Michael.
It's good to be here. Thank you for having me.
Yes, I just love the things that I learned doing this podcast. And so I'm very excited to ask you, what in the world is augmented reality and what does it have to do with knee replacements?
Well, so augmented reality, think of a fighter pilot in a jet that has a visor over their eyes that's displaying electronic data that is overlaid over what they're seeing in the real world. So don't confuse this with virtual reality that your kids have at home, that they're playing video games with their eyes covered. This is typically some sort of glasses or helmet-based visor that's displaying information in front of your eyes that's rendered digitally, that is being processed from a computer to give you additional information or for entertainment purposes, some other display in front of your eyes.
So do you wear goggles?
So for this particular system that I use, it is a helmet-based visor that is placed over part of our vision. So as a surgeon, I definitely want to have unobstructed view of what I'm seeing while I'm operating. But
Right.
This system has a visor in front of my eyes also that's projecting digital information in front of my eyes outside of the area where I'm specifically operating.
So how does augmented reality help you do knee replacements, Michael?
So for a while, we've had computer-assisted surgery where we've been able to take data from the patient's own leg and enter that into a computer and have it some of this information displayed for us to help us understand how best to remove the correct amount of bone in the right angle to make the knee replacement fit better and to have better alignment of the limb after surgery. The problem with some of those computer-assisted programs is that there is a screen that we're looking at across the room, or a computer that we're looking at across the room, so that we're having to take our eyes off the patient. And also, to collect some of that data, we're having to use instruments or a computer across the room and cameras across the room that we're having to take our eyes off the patient to collect data. In this system, all of that information is being gathered by the helmet-based system. So there's actually, in addition to a projection from the helmet-based system, there's also cameras that are recording information from sensors on the patient's knee so that all of the information is being gathered by the helmet-based system and then displayed to me on the helmet-based system.
That's truly fascinating. The anesthesiologist in me, as a resident, I remember watching many knee replacements and thinking how incredibly I was amazed at how precise you have to be with the angles and the cuts that you make so that the replacement fits. That sounds amazing.
Yeah, it's really the next step. What we see in orthopedic surgery is the ability to get real-time feedback in what we're doing while keeping our eyes on the patient and not having to have, large pieces of machinery come in and out of the room to help us with our surgery.
Does it make it more precise then, Michael?
Well, that's hard to say right now. So this
Okay.
technology used in surgery and knee surgery has only been around for the last couple of years. We did the first augmented reality case with this system this fall here at Mayo that had ever been done before. So this is, really innovative in that we don't have data to say long-term, this is going to, change the patient's outcomes. We need more information.
So Michael, I imagine this is an area you're still studying. So how do you decide if an individual might be a candidate for an augmented reality knee surgery versus the more traditional way you've done this?
Yeah. So let me explain a little bit about how traditional knee replacement is done. As people say, well, okay, you're using this, how was it done before? Well, in traditional knee surgery, we're placing mechanical alignment jigs on the leg and then using those to determine the alignment and the sizes of the implants.
Okay.
So in augmented reality and these computer systems, we're collecting digital data, the shape of the bone, the alignment of the leg, and then the computer is assisting us with that information and then displaying where we should cut back onto the screen. So the amounts and angles are being determined by the computer. So right now, for just about any first-time knee replacement, any patient would be a good candidate for augmented reality. In some more complex situations or revisions where we haven't been able to test the system on these situations, or there isn't enough bone to make these measurements that we need to make, then they wouldn't be a very good candidate.
Michael, I'm curious. I'm trying to picture this, and I'm curious, just if it's inside your helmet and you're seeing it on does movement of your head make a difference when you're looking at the knee?
Yeah, so the system is really incredible in that when you move your head, it moves with you.
Oh.
And you can set through the system where you want your information to be displayed, but it knows when you move your head, so it's moving the information to keep it in the same area of your visual field, no matter where you put your head.
That is absolutely fascinating.
And you can actually move the cursor with your head so that you can select menu items by moving your head. It's also really cool because it incorporates voice recognition through an artificial intelligence algorithm so that it knows what you're saying. So I can tell it, go to the next step, or go back a step, or I'm ready to place the guide. And it will go, through the menu. I can tell it to turn the light on because it has additional lights to help illuminate the field. I can say, turn the light on, and it will turn on the light.
Michael, what are the benefits of using augmented reality for knee replacement or for a patient undergoing that procedure? And are there any potential downsides?
So the benefits of this augmented reality system is that we can make more precise and accurate bony cuts and make the angles more correct to make the limb more straight than we did before. Not that we weren't before, but what we want to do is reduce the outliers and make that precision more. So that's where patients can benefit, is we can more efficiently and more precisely do their knee replacement. The downsides, well, it's new technology, but we actually feel like this is a technology where we can become more efficient with the surgery and actually it not take us as much time because we're not having to use all the mechanical guides. So we think with time, it's actually going to be a time saver. And then if we can prove later on that the outcomes are better, well, if we reduce further surgeries or, complications with patients, we can, improve their ability to return to their activities of daily living for a longer period of time, and then reduce healthcare costs as well.
But speaking of which, Do you see any differences in length of hospital stay, recovery, or rehab for patients who undergo augmented reality versus traditional knee replacement?
It's really hard to say at this point. I would say thanks to our collaboration with our anesthesiologists, who are wonderful here at Mayo, we've been able to reduce the length of stay through multiple different things, through our postoperative protocols, pain management, and the spinal anesthesia, et cetera. We've been able to make huge strides. So we hope that reducing the length of surgery and the amount of tissue trauma that we have to create through using these kind of systems, that we can further increase their outcome and reduce their length of stay and pain and rehabilitation.
Michael, is this technology widely available at this point?
No, it's not. We're one of the few centers that's working on this at this point. So this is a limited access at this point. I'm one of the few surgeons in the world that's doing this.
Oh, it's fascinating. And it strikes me as so many things in medicine that the more, and in surgery in particular, the more of them that you do, the better you are likely to be at it. So patients would want to go to a center where someone was gaining quite a bit of experience.
Yeah, I think practice makes perfect. And, I focused my entire practice on hip and knee replacement. That's all I do. And we've been able to show in our data that we're able to do these types of procedures more efficiently with a lower complication rate than if you're not doing as many, or if you haven't done as many.
Mm-hmm. Will this be coming to other joint replacement surgeries as well?
Yeah, so we were focusing on knee today, but I'm also using it on hip replacement surgery to help more accurately place those implants and recreate the leg length and offset in hip replacement. The length of the leg and the position of the femur relative to the pelvis.
Wonderful. Thank you for sharing this with us today, Michael. It's fascinating.
Yes, it is. And thank you for having me.
Our thanks to Mayo Clinic orthopedic surgeon, Dr. Michael Taunton, for being here today to talk about augmented reality used in knee replacement surgery. I hope that you learned something. I know that I did, and we wish each of you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.